So a few years ago, I started coming to this awareness. I want to say conclusion, but it actually was the beginning of an understanding that I was, in the words that I would have put it in at the time, and that I did put it in at the time, that I was highly psychosomatic. And I remember, and this is when I was digging into what was happening with me on a physical level with regard to my chronic pain in my hips, both hips, particularly my right hip and my lumbar area, and which started taking over my body and thinking it was my fibromyalgia and whatever, blah, blah, blah. And as I was going through this process of the healing process, was further and further realizations of this psychosomatic theme. And at first that hit me the wrong way. It triggered me in certain ways, because in the past, that had been that phrase, that word, or that kind of way of thinking had been used in a derogatory manner. And the idea of it connected with this theme of me being too emotionally triggered, and having being reactive and various other things, which now in hindsight I can see all of that in such a different way. But whatever the case, this word psychosomatic was charged, and particularly because in the last 150 years, medicine has been taken over by one lens, one way of looking at things that takes away the psyche, that reduces everything to materialism and everything to purely physical. Everything is chemicals. And so when you divide the individual, when you do try to bring it, and that's the way that the majority of people are taught and are looking at things, then if you do introduce the fact that the individual is whole with a psyche, it seems crazy, And if you're psychosomatic, there's something actually wrong with you. Look, you're psychosomatic. Everybody else is just, have these physical things, but you are psychosomatic. These were some of the ways that, at the time, the narrative had pushed in on me. But I actually took that word psychosomatic and started embracing it, because I saw in it the cause. And I was realizing that if the cause is not involved in the diagnostic or the prognostic, how is there any hope of therapy and healing if you aren't looking at cause? And this was just the intuitive journey that I started on, was this realization, this embracing of my psychosomatic nature. And I say my psychosomatic nature because I was seeing it so clearly in myself, where around me I wasn't hearing that so much. And I even remember somebody who really helped me in terms of changing things around in my quest to get out of the chronic pain I was in, and to be able to move again. And I went to see him for treatments that were phenomenal and really helpful in this. And the treatments that he was doing were part of what was making me see the emotional connection to my physical. And I said to him at one point, yeah, it's just all emotional. And he goes, no, it's not all emotional. Come on. It's just, some things are. And inside me there was like this, no, I know it is, actually I know it is everything I'm doing here, because this work he was doing with the particular work with the nerves, with the nervous system, and it was triggering memories, it was triggering stories, it was triggering all of these things that a lot of things that I had forgotten, things I had left behind, things I had tried to cover up. And in those things resurfacing and in facing them and dealing with them and integrating them, and I would say it's integrating in the form of also just letting them go, was also part of integration. And that is where I was seeing the changes. And so for me, it was so obvious that it was emotional. And of course I was working on myself in terms of strength and mobility, and those two would be the main themes of what I started working on a physical level. But the emotional part was always right there. So the psychosomatic theme became primordial for me. And it started to be where I dug and investigated. And my investigations led me all over the place. And in the last few years, with the catalyst of what we've been through in the world in the last few years in terms of health, and all the doubts that rose in me from watching things happening that didn't make logical sense, that didn't align with what I knew about the body, didn't align with what I knew about health, didn't align with everything that I had dug into, investigated, researched, and tested on myself. And then I saw the whole world going crazy with a narrative that I couldn't relate to. And that had me investigating even more. And so this theme of psychosomatics actually led me to a place now where, in a way, I can throw away that word because it doesn't fully embrace what I see to be true. No. I'll try to explain that, but I would first say that don't bother listening anymore if you have no doubts about the current medical paradigm, if you have no doubts about the conventional allopathic system, if you have no doubts about the story that your doctor tells you, if you have no doubts about the story that public health tells you, if you have not had any reason to doubt any of that, just turn me off right now, really, because there's no point in listening anymore. But I'm fueled by doubt and I'm an investigative martyr. That is, a martyr of my investigations. I will investigate on myself, and I will trial and error on myself, and I'm digging to find out what works by throwing away what doesn't. And so this doesn't work, throw it away. This doesn't work, throw it away. And I'm going further, no, it doesn't. And for me, it's been really around this theme of health and well-being, and what is health really? How do you be healthy? And I feel that as someone looking for a solid foundation, I have found something pretty dang solid. And I'm still testing it, but it's changed everything for me. So if you don't question things, then don't even bother watching anything that I share. Don't bother, really don't. But if you do have questions, if you have not been well served by the system that was installed around 100, 150 years ago, that before that was completely different, If you haven't been well served by that, then possibly what I say could be interesting to you. So psychosomatic. So the problem now that I've found with that word, and the fact that it doesn't encompass the full foundation, is that what it says is you have a physical problem in your body because of a physical issue, because of an emotional, spiritual, whatever, problem in your psyche. So this problem in your psyche is creating a problem in the physical. And there's something there that makes sense, right? It is acknowledging the fact that we have something primordial to the physical body, something that you could call, there are different ways that people put this, the etheric body, the astral body, the spiritual body, depends on which lens you look through, but that there is something that is primordial, that comes first, and the body is then the material form of what happens on a different plane first. Yes, but now with the knowledge that I have through studying Germanische Heilkunde, Germanic healing knowledge in English, I like to use the German name, even though I don't speak German, because it does encompass the idea in a much more holistic way. So Germanische Heilkunde, this knowledge that is about the art and science of skillful healing in brotherhood and sisterhood, in acknowledging our interconnectedness, in acknowledging that we are not solo islands, but we are connected with the world around us. And it's this dynamic and this dance that we're in together that that ignites certain things that happen in the body, and with a specific purpose. And that coming back to health, that health is actually a process of making changes that need to be made purposefully, and then coming back to something of a homeostasis, homeodynamic way of being. And that's the flexibility that is health. And that process is supported by this art and this spiritual knowledge. So what is it? Germanische Heilkunde. Okay, so it's not psychosomatics, because in Germanische Heilkunde you are not looking at a problem in the psyche that creates a problem in the body. So we need to throw that out. We actually have to throw a whole lot of stuff out if you come to this knowledge. So again, I'm going to say, if you've not had any reason to question anything, just don't bother listening, because taking this path, you have to throw a lot of stuff out. And my father is a cardiologist. I grew up within the whole paradigm of conventional medicine, though long ago when he was practicing, there was still, I think, a bit more humanity in the system. Anyway, so then what Germanische Heilkunde does is the knowledge that was discovered by Dr. Hammer in 1978 to 1981. He put forth the discoveries in 1981. But this discovery was of the connection of the psyche with the organ mediated through the brain. So it is the knowledge of how the individual works biologically on all three levels at the same time. So the division that's been made, in conventional medicine, you go to see a doctor, they're not going to talk to you about your psyche. Most of them, some of them start to realize, like, we've left this thing behind. But if you go to a psychologist, they're not, most likely not going to be so interested in your organ. So we've divided in every kind of science that we do right now. It's part of what needed to happen in this age of going deep into details. But now we need to come back out of those details, and we need to look at the whole, because without doing that, we do ourselves a huge disservice. And so the point is that I am an indivisible individual, and whatever I'm going through is happening on these different levels at the same time, synchronously. And specifically in Germanische Heilkunde, it looks at the psyche, the brain, and the organ. And so you can watch the process of what has previously been called disease on these three levels happening synchronously, simultaneously and synchronously, through a process of what is called a senseful biological special program, rather than saying disease or illness, because through this lens you now see that there's a purpose to everything that's happening in the body. There's a meaning. So that's the difference between a psychosomatic, where I have a problem here, so now I have a problem in my shoulder. I have a problem here, so now I have a problem in my liver. No. You have an event that shocks you. Okay, so the beginning of a special program happens with what's called a DHS, a Dirk Hammer syndrome. And this was the name of Dr. Hammer's son, whose death was the beginning of Dr. Hammer's and his wife's cancers, which were the beginning of his investigation into the psyche correspondence with cancer in all of his cancer patients. And it was how he started to find these correspondences on the three levels that were 100% all the time in action, and led to him delving deeper and deeper and discovering this body of knowledge. So the Dirk Hammer syndrome, what is it? It's a shocking experience that hits your psyche on an unconscious level, something that happens to you. Sometimes it could be a small shock, sometimes it could be a really terrible one, and that will have influence on how intense of a program you go through. But it needs to have three particular characteristics. So it needs to catch you on the wrong foot, as Dr. Hammer said it. So it catches you off guard. You're not expecting it. It's a surprise. It's something that takes you by surprise. And so imagine if you were expecting to be laid off from your job, and then it comes. That's not a surprise if you were expecting it. So it wouldn't be that. It needs to be something that really catches you off guard. A phone call, all of a sudden it says, hey, you're done. We're letting you go, out of nowhere. Okay. So that would be shocking because it catches you by surprise. It makes you feel isolated in that moment. In that moment when you're living that, you're alone to face it. There's nobody else there to help you with facing it. And that can be that you're in a crowd or you're surrounded by people, but you feel isolated from them at that moment. I could be in a room with people hanging out, and I get that phone call. And at that moment where I hear this phone call that takes me by surprise, I feel alone in it. There's nobody there to listen to the situation. The situation doesn't have to do with anybody else. It only has to do with me. So there's an isolating feeling in that. So it's a shock, it's isolating, and it's acute dramatic. So it's a situation that does have this dramatic feeling to it, and acute means it's a moment. So that means that it's not about long-term stress. Long-term stress is not good for the body, but that's a whole different story. It's not going to lead to one of these programs. It needs to be acute. So it is that sudden phone call. It is that sudden death I wasn't expecting. It is a spider that appears out of nowhere and freaks me out. It can be as small as that. It can be as big as you're talking to somebody, having a nice conversation, and all of a sudden they say something that you would never have expected them to say. It goes completely against what you like, all of your essence, and all of a sudden you feel isolated from that person. I'm talking about something that actually happened to me and led to a program. So I mean, it can range so much because it's all individual. It's based on how your psyche interprets that particular event. So all so-called disease is a senseful, biological, special program that your body, psyche, brain, organ, runs simultaneously on all these levels with the goal, with the purpose of you solving that conflict. So you can call that Dirk-Hammer syndrome a biological conflict. It's biological. And so this is the beginning of things. And it's not a problem that happened that creates a problem in your body. It's a shocking thing that can be problematic that now you need to have a response to. You need to have a resolution to. You need to find some way to resolve this. Okay, so you all of a sudden get this phone call that shocks you. You're all alone. It's acute. It's dramatic. You've been fired from your job. Okay, well, now you need to resolve this, because how are you going to feed yourself? How are you going to pay the bill? How are you going to... This thing that needs to be some kind of a resolution to this shocking situation. And so your body makes changes on an organ level based on where this hits you on the brain. Because as soon as your psyche interprets this in its own specific individual way, it will hit you on a specific place in the brain, and it called the brain relay for a specific organ. And then it's on that organ that you will develop the program to help you resolve this. So it's always about, how can I resolve this? Let me give you an example. Something that is quite common, which is called an indigestible anger morsel conflict. And so this would be something shocking that happens that is just this, makes you angry and you just can't digest it. So that's going to hit you on your brain relay for your intestines. And now and that's because your psyche interpreted that event in that particular way. I can't digest this thing and it makes me angry. Now you've got this anger you can't digest, and you've got to find a way to digest it, get it out of you. And so your body will start now making more proliferation of cells in your intestine. Why? To help you digest. To help you digest. And in general, in this first phase, you're not going to feel much changes. You're just going to feel like stressed. You will feel cold hands because you've gone into a heightened sympathetic mode. So now you've got, a faster heartbeat rate. You aren't sleeping very well. Your psyche is obsessed with this thing because it's trying to solve it. You've got cold hands because your blood is centralized so that you can do what you need to do to solve the situation. And that's going to be kind of what you feel. And because most of us are living in stressful ways, we don't always feel this first phase of our program, which is the conflict active phase. But once you find the resolution to that, which is the whole purpose of this, we need to digest this, we need to digest this, we need to digest this. So let's have more cells there, let's have more capacity to digest what's not moving through the intestines. Now when you've solved it, you've gotten over your anger, that person has left you, whatever it is, now you can go into resolution and you go to the second phase, which is the healing phase. And this is what we call being sick, because it's in the healing phase where things need to be put back in the way that they were before, and it's where we feel uncomfortable. So in this case, with the indigestible morsel, now you've got this cell proliferation, which if it went on for a long time, could be diagnosed as a intestinal cancer, a tumor. But if it's short, what's going to happen? It's going to be broken down by the bacteria and the fungi in your intestine. And it's going to have to be get out of your body. And all of this healing phase happens in a liquid environment. So there's edema, you feel probably a bit bloated. You're going to maybe have headaches because on your brain, there's a mark there on that brain relay for your intestine. And now there's edema there because that needs to be healed as well. And so you're going to feel now your psyche is relaxed though, because you've solved it. Now you're calm about that situation, and just, it's like this weight falls from you. But now you're tired because you go into this lasting vagatonia. You're tired, you're not really having any energy, you have pain now, and now maybe you're starting to have diarrhea. You may even have blood coming out, because those cells were temporary cells. That tissue is temporary tissue that needs to get broken down and get out. You don't need it anymore. You resolved the situation. Once you pass this, and if you were conflict active for 4 days, you're most likely going to be feeling sick in this healing phase for about 4 days, maybe a little bit less. There's going to be one part in that healing phase where it's stronger. It's what we call an epicrisis, without going into too much detail. So in the middle of that second healing phase, there might be more severe pain. And after you pass that moment, then you're in the scarring phase, just scarring the tissue, putting your brain on your brain relay. It's glia cells that are creating a scar for healing. The water is pushed out from your brain. The water is pushed out from your organs. You actually pee a lot after that moment of the crisis, and then you get better and better and better, and then you're back to normal health, ready to move, ready to go, do normal day-night rhythm. And this is how the psyche is working with the brain and the organ, not to reflect the problems you're having in your psyche, but actually to solve the conflicts that you're being confronted with in the life that you live in community. And so this has changed everything for me. And the huge thing for me is that it completely aligns with what I was already finding for myself, is that I can trust my body. I can trust my body. If my body is my authority, and then all of a sudden it's making mistakes, it's breaking down on me, it's hard to trust. But with Germanische Heilkunde and the knowledge here, and I've summed it up too simply, sorry, but I wanted to give you just an example of how this works, is that I can see now there is a reason. There's always a reason. My body is always doing something with a purpose. There's always meaning. That's why it's called a senseful biological special program. There's a sense to it. It's significant. There's some reason for it. And so the body is not just making mistakes and blah, 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 blah. It's actually always striving to help you solve things in your life and survive and thrive and do well. So in Germanische Heilkunde, you cannot get better unless you're dealing with cause, which makes so much sense. You don't now treat symptoms. Each case is a case, and so you might have to use something to make you a bit more comfortable, or there's certain emergency interventions that need to happen. Everything is so individual. When you get into the knowledge and you understand where things are coming from, why it's happening, what is happening in each phase, how long the phases are going to last, all of these things. Now you actually have the knowledge you need to know what you need to do to make the right choices for your health. And so an example is, I'm not going to get into details. If you want to know some of the programs that I've had the last year, it's on my website. I've shared, so you need to read. They're scary names if I say the name from conventional medicine, but I didn't go to see a doctor. Because I knew exactly the cause, I knew exactly what was happening, I knew exactly what to expect, and it happened exactly according to the knowledge of Germanische Heilkunde. And so I just made certain decisions. Actually, my body led me the whole way. There was one time that my body craved more protein, which made so much sense when I knew where I was in the program and what program I was running. And then there was another time my body told me, you need to stop everything you're doing, and you just stop. And so for 2 weeks I stopped everything, and I went for a week to the coast, because I knew my body needed just time and rest. It needed to finish what it had started. I had been conflict active for a couple of months, And it was going to take a while for me to get through the healing phase. And it was not easy. And there were moments that were kind of freaky. But this knowledge gave me peace and calm and helped me with the normal anxiety that you feel, because we're so programmed to be afraid of our bodies, and to be afraid of certain words and certain diagnosis. But with the knowledge, I knew what was happening. And I knew that I just needed rest and time, and I needed to stay as calm as possible so that I didn't complicate things, and let my body finish the process. And it did. I got on a track, which is a whole other story. And so it took me a while to really complete it because I kept triggering it again. And by the way, my track was that was triggering the chronic nature of it, was somebody very close to me. So then what was the therapy? I needed to change my perspective with regards to that person. It was either cut them out of my life or change my perspective about our situation, our relationship, what was happening. And that was a lot of work I had to do, inner work that I had to do. But so far so good, because I haven't had an episode for a while, which means it seems that track I've been able to erase. So this turns everything on its head. Number one, disease and illness, those are words that don't make sense anymore. They have no meaning. And I'm talking about extreme disease and illness as well, not just small, simple things. Talking about all of it. And psychoses, because that knowledge is within Germanische Heilkunde as well. Which, by the way, I saw that in myself. Manic depression for some months. As soon as I resolved the conflict and went into healing, manic depression went away. I mean, it wasn't severe, but it was there. Went away. Once you can throw those words away and start looking, okay, the body has a purpose for what it's doing. There's meaning for it. What is the cause? You can look and you can find the cause. You know the cause. It's in your psyche. And then the therapy, the treatment is you got to deal with the cause. And you got to deal with anything around the cause that could trigger you to keep this chronic. And so, the therapy is so varied. It just throws out the window the idea of protocol. There is no protocol. There is no one size fits all. And this was something that to me made so much sense, because it was a thing that was the craziest to me the last few years. Crazy to me that there's a one size fits all for 7 billion people or whatever. There's no one size fits all. My body is my body. Yours is yours. It's impossible. Health is not about here's the same size Band-Aid for you as for me, and you keep it on the same amount of time. Crazies. And so in Germanische Heilkunde, you throw that out. There's no magic pill, which means, again, this is not for everybody, because there's no magic pill. There's no savior outside of you. There's no doctor that's more than you are your own doctor. You got to throw all of that out. So I know that. And somebody said to me the other day that I was, that they asked me a little bit about this, and I started to share, and they're like, that people are going to call you crazy, right? People are going to call you crazy. And I was like, sure. I know that I'm not going to be talking about this to many people. The people closest to me, there's one that I can talk to about this. There's one that's interested. Because you've got to first go through the breaking down the foundation that doesn't work. And not many people are there. But I can tell you what, I am so thankful that life brought me this knowledge now. Because I'm watching. I'm looking out there. And I'm watching a broken system. And I am watching experts and authorities and institutions falling down, breaking down. And the support that we've been used to, the communal support that we've been used to over the last centuries, if we look at it from the human design, that's going away. I mean, I can't tell you that for sure, but this is the knowledge of human design. It's what I'm watching. It's going away. Look at the chaos. Look at the chaos. Look at the insanity. And at this time now, I have this knowledge that I can be my own expert of my body. My body is its own expert. It's like the most beautiful, amazing gift at this time that I see so many people freaking out about health. So many sad stories that really hit me. And in the middle of this, I haven't been to a doctor since 2019. And I don't plan to go back. And I'm speaking as the daughter of a doctor. So I'm thankful. I am thankful for this body of knowledge that what's beautiful about it is that you don't believe me. Don't believe me. Go study it, look into it, and then test it. I'm not afraid of you testing it because it's been proven thousands and thousands and thousands and thousands of times over for the last 40 years. 100% of the time. Yeah. So you test it for yourself. That's what I did. Tested it last year and it proved itself. And then I tested it again and it proved itself again. And I tested it with a really scary situation and it proved itself again and again and again. And so it has changed completely the relationship with health and with my body. And for me, it's not for everybody because it depends on your situation, but for me, there's no more meds. Sometimes when the pain is too bad, maybe a painkiller. And there's no more supplements and vitamins and blah, 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 blah that I was spending so much money on. And I'm not afraid of foods now. I'm not afraid of that food is bad for me or that food is bad for me. I let my body eat what it wants to eat. It's changed everything. So this has gone on quite a lot. I didn't actually, as always, had no idea I was going this way. But there it is. It's out there now for a few ears. Yeah, a few ears who are ready to hear and who need it.